This morning, the American Academy of Pediatrics has declared a children's mental health crisis. Doctors say kids are being impacted by multiple factors in the pandemic. They say educators are seeing more bad behavior in schools.
Yeah, we're seeing this in the classroom. We're seeing it at home. It's just very pervasive right now. Dr. Travis Gayles is from Hazel Health. Hazel Health is the company that provides telehealth in schools for physical and mental health. He's joining us now to talk about the challenges that kids are facing right now and what parents can do to help. And really, it's the challenges that teachers in many cases are facing right now. After the kids have been through so much, families have been through so much, now they're back in school. We're kind of seeing the residual effects. Good morning. Thanks for joining.
Good morning, Brandy and Ty. Happy to be here.
So yeah, go over the issue here. What are we seeing exactly? What are the percentages and what age groups?
Well, the age groups, it's all across all kids. And what we're seeing is before the pandemic happened, that there was significant dearth of resources available for mental health services, both inpatient and outpatient. And as you laid out, the pandemic has hit our children hard. And as they're adjusting to coming back into school, it's manifesting into increased fights, particularly in the middle school population, increased complaints of belly aches and headaches in our younger kids, which typically mask mental health concerns.
Right.
And in our older students, we're starting to see, more disconnection from the activities that they typically enjoy and different outside of their friend groups that they enjoy as well.
And so, Dr. Gayles, parents that are watching this morning will maybe key in on some of those things that they are also seeing in their children. But what do they do about those things when they are hearing these signs at home, even before sending them to school? How do they address them at home?
Well, I think the biggest thing is being present to acknowledge that they're happening and identifying that they're happening and figuring out ways to get their children connected to activities that they enjoy, that they've historically enjoyed, but at the same time, making sure they're connected to their provider. If they have a primary care provider, physician, trying to get them into appointments, and working with the school as well to identify other resources that can get their children linked to someone who can talk to them and to work through their particular issues if they aren't able to establish that direct communication themselves.
And Dr. Gayles, just to go over one of the graphics that we have from your research, 17% of youth, 16 to 17, experiencing a mental health condition each year, becoming the worst of the pandemic. Depression, anxiety, doubling during the pandemic. So almost 20% of kids in schools are dealing with this anxiety, this depression, and of course that manifests itself in very uncomfortable ways for the student and for the rest of the students and the teacher in the classroom.
Yes, and it underscores the need for getting kids services that they really need. And we also know that 17 to 20% that you mentioned probably is even higher for the children who we haven't identified, who aren't coming in with a crisis or coming in with significant symptoms of concern. And that underscores platforms like ours, Hazel Health and other companies that are providing a new creative, innovative way to cut down on the time between when a student is identified as having need and when we can get them in. In addition to that percentage of students who express those symptoms, we know that wait times, unfortunately, in many places are anywhere from 6 to 9 months for services. And programs like ours, for example, have been able to shorten that time from the initial referral to when they are able to talk to someone to as little as 7 days.
Dr. Gayles, we have about 20 seconds here. Finally, though, I want to ask you, there's a lot of questions about what the long-term impacts of the pandemic will be on children. What do you believe will happen if these mental health concerns are not addressed?
Well, we'll grow up with a generation of kids with unmet needs, and it's important to highlight the need for creating a culture of prevention around mental health services. We've got to create systems and create resources that don't wait for our children to have a crisis or come in with significant symptoms. We've got to come up with some strategies to identify kids more proactively and be able to link them to support services to address their needs before they get to a crisis situation or their symptoms get out of control.
Yeah, time is of the essence here. Dr. Travis Gayles with Hazel Health, a telehealth company. We really appreciate you bringing this to the forefront of the conversation this morning. Thanks.
Thank you and have a good day.
And Brandy, as you know, when our kids are upset, when they're misbehaving, it's because there's something missing, something they're not getting. So everything the doctor's saying, anecdotally, is true. And
depending on the age of the child, and even some older children, they have a hard time articulating that.
Right.
So you have to, like he mentioned, you have to be keen in on what's happening with the child.
Yeah, it takes a lot of time and energy for sure.